Hi, I'm Patty McElreevy, President and CEO of the Center for Disaster Philanthropy. It's my pleasure to welcome you to the Interaction 2021 Forum Learning Session, COVID Aftershocks, Funding Challenges. The onset of COVID-19 was a stress test of the international humanitarian system on a scale previously unseen. A truly global emergency was being faced in the form of a pandemic, impacting donor countries and countries already locked in the throes of existing humanitarian crises. The nature of the pandemic meant that time was of the essence, meaning donors and frontline actors had to move at a rapid pace to put measures in place to respond to the virus's spread. It also meant that significant efforts were required to adapt existing humanitarian programming to allow them to continue in an environment where movements were restricted, distancing was required, and supply chains were disrupted. The two requirements, speed and flexibility, of an effective humanitarian response are critical. However, the humanitarian system, its financing, and the processes of partnership do not always align to this achievement and the goal of an effective humanitarian response. A year on, we're here to explore how the humanitarian system functioned during this stress test. What did we learn about how resources got to frontline actors? How well were donors able to adapt their agreements with partners to allow flexibility in the face of the unknown? And most importantly, what does this experience mean going forward for the humanitarian community? And most importantly, what does this experience mean for the way forward and the humanitarian community's collective ability to pivot in the face of new challenges? To discuss this with us today are three experts in the field of humanitarian response. Greg Ram, Vice President for Humanitarian Response at Save the Children US, Jeremy Rempel, Head of Humanitarian Financing at the International Council of Voluntary Agencies, ICVA, and co-chair of the IASC Results Group 5 on humanitarian financing, and Alice Armani Sequi, Chief of the Pooled Funds Management Branch in the United Nations Office of the Coordination of Humanitarian Assistance. Welcome, everyone. Greg, let's get you started. Start off with you today. Save the Children is on the front lines of several humanitarian responses around the world. How did the onset of COVID-19 affect your operations?
Well, thanks, Patty, and thanks for this important conversation. Had a profound effect on us right from the outset, and it affected us globally, including here in the U.S., which is unusual for a crisis. So it had immediate impact on concerns about business continuity and health and safety. But we were fairly rapidly able to pivot to looking at the program impact and what did we need to adapt, and what did we need to do new. So we quickly set out a set of global programming guidelines for a framework, helping country offices try to take things locally. We realized that no one size fit all in this moment, and so we needed to give tools out to our country teams so that they could adapt. We needed to find additional funding. I know we'll get into that. We needed to be as flexible as possible. We now needed to allow each country and each country program and each humanitarian response to adapt as needed while trying to keep essential operations open. I think there were two things that we did that we saw early on in our work. One was this question of how do you pivot out of a crisis that affects you directly into programming. I do think we see that in other places, lessons for that in places like the crisis in Tigray, where you're immediately talking about program continuity and business continuity and staff safety, but you have to get onto programming. And I think that's the thing we should learn and think about in all crises. The other thing was this was a crisis that affected both humanitarian and development programming. So it was an interesting lesson for us. We tried to apply our humanitarian principles and ways of working and to be agile and quick across all contexts. But there were a bunch of colleagues who said, well, this is not just a humanitarian endeavor. And therefore, we had to figure out how to work across. We talk about Nexus programming. We had to learn to work across in a much better and faster way across humanitarian development expertise to get this one right. But that led us to things like health messaging and stop the spread in Sudan and other places, education work, how to support remote learning, what to do when schools closed, how to set up very rapidly an isolation unit in Cox's Bazar, and even more importantly, how to take a survey of thousands and thousands of kids around the world to listen to the voices of those most affected and what they would have us do.
No, that's really interesting. I mean, it's incredible that the flexibility and the nimbleness that the NGO and the nonprofit community have had to show in their programming. And what types of flexibility and funding did SAVE need to be able to rise to these challenges?
Well, we very quickly out of the gate needed more money, and we needed what we had to be flexible, and the money we received had to be flexible as well, because we weren't quite sure how this pandemic was going to play itself out. So the first thing we did was, when we have the advantage of we work both domestically in the US on early child education, as well as disaster response, and we work internationally, and this was affecting the US. So our early appeal was out for both work in the US to respond to the range of needs tied to COVID, and internationally. That allowed us to interest a public that was very focused on domestic issues and raise funds for both domestic and internationally. We went to our donors and asked for flexibility on what we needed to do on existing funding. And I think we, broadly speaking, did find most donors to be flexible. USAID in particular did not cut funding even when programs had to be suspended, and on humanitarian responses allowed flexibility. And we worked globally on the global humanitarian response plan led by the ISC. Now, we did that, and I have to say there were some interesting lessons there, because at least out of the first gate, we all worked on that. In the first instance, that did become a bit of a UN funding appeal. And I do think for the NGOs, there was a challenge about, should we have spent more time on our own funding appeal rather than that collective effort? And it did take a while for some of that funding to reach the field, both on the UN side and on the US government side. I think everybody on this call will be aware how long it took the COVID emergency funding through OFDA did not come out as quickly as it typically did. There were very substantial political considerations. There were early discussions on branding and marketing. There were later discussions on PPE and things being excluded that you would normally have in any kind of a program in a health emergency. So I think we found both opportunity and challenge as we got into that.
No, that's really interesting. I mean, from CDP's perspective, we did see the same. We saw philanthropy coming in very heavy, and then governments driving a lot of the funding into the UN as well. So it's an interesting dimension there that hopefully we will take a lot of lessons from and have a more robust conversation here and learn from all of you. Jeremy, I'm going to turn to you. I understand that there were concerted efforts among humanitarian NGOs to seek the flexibilities from UN agencies and bilateral donors, exactly as Greg has highlighted. What specifically were the changes and adaptations that NGOs were looking for?
Thanks, Patty. Yeah, I think building on some of the comments we've already heard from Greg, certainly uncertainty is not something that's unexpected in humanitarian response, but I think that the truly global nature of this pandemic did present somewhat of an unusual challenge when it comes to setting up funding streams. And it was recognized early on in COVID-19 response that I think funding was going to be a challenge. As Greg has already highlighted, when it comes to how we started to develop specific measures around flexibility, around the need to speed up process, unlock funding, there was a little bit of a time lag between when the pandemic was really starting up and when we got down to some of the details of working out funding flexibility measures, et cetera. So one thing that was identified through the IASC was the need to unlock these funding streams. And 4 particular approaches were identified: one around strengthening national NGO engagement, another around increased use and access to pooled funding, another around better data reporting, and then finally improving how funding is passed through UN agencies to NGO colleagues in the field. And it's under that item in particular that we got into funding flexibility measures. So through the IASC in particular, we started to look at some key areas in which we could propose that flexibilities be introduced initially under COVID response. That developed into 9 specific measures that were identified and approved through IASC. And I'll list those quickly for those that are interested in looking more. You can find these. It's a published document on the IASC website. But generally, we looked at no-cost extension, linking GHRP funding to existing programming, improved budget flexibility, direct costs, covering direct costs linked to programming, direct programming costs and support costs to NGOs, so extending a discussion around indirect cost coverage, simplifying due diligence and risk management, electronic signatures and approval, so simplifying that process, reducing reporting requirements, and finally simplifying release of funds. So it was a fairly comprehensive package that was looked at across all of these 9 different measures to try and get some common agreement for how we would approach funding flexibility. And maybe something to note, I think this was a negotiated discussion, so done through the IASC, both with UN agencies and NGO partners to try and come to as close to a consensus approach as we could. I think that it generally covered the areas of greatest concern. There were a couple areas missing from that, I think, on the NGO side that were of concern, maybe that increased in concern later on, certainly around match funding requirements and how we may have needed some increased flexibility there that was not specifically part of the collective approach. But we were able to identify, I think, a fairly comprehensive set of flexibility measures to attempt to introduce under COVID response.
That's quite a list. How successful were these efforts to seek, the flexibilities? What were most donors and UN agencies able to accommodate the requests?
Yeah, so I think when it comes to success, a couple of things to note. One, in general, the word we hear from colleagues in the field is that flexibility measures did make their way down to field response, and people did make use of funding flexibility measures. I think, as Greg highlighted earlier, the question of speed is definitely something that comes into play. So certainly, taking lessons learned, had we been able to implement some of those flexibility measures sooner, I think it would have had a greater impact and certainly would have a longer time period within the year of COVID response to have impacted our ability to shift gears, be flexible, respond better. So I think generally, yes, successful. The speed certainly a little bit of an issue. When it comes to the breadth of donors and agencies using the flexibility measures, important to understand a little bit some different approaches between the donor government crowd and then the UN agencies. So something that we did through IASC fairly early on was to start with an initial advocacy push with the GHD to try and at least make donors aware of the need to improve flexibilities. And then we shifted and introduced the 9 flexibility measures that we agreed to between UN agencies specifically and our NGO colleagues. And then later tried to circle back with donors as well to improve consistency in how some of the donors were also aligning their flexibility efforts with some of the specific measures we identified through IASC. I think, again, that was stretched out over quite a long period of time. So by the time we were circling back to donors with specific measures, we're already pushing into the fall of 2020, which again, in terms of the speed question, is a little bit of a weakness, I would say. But we did have, I think, a good level of participation, certainly among UN agencies as members of IASC, and among donors themselves. I would say when it comes to consistency, maybe less consistent with regard to how some of the donor governments were applying measures in alignment with our IASC 9 measures that we introduced. In part, though, I think that had to do with some of the time that it took to go circle back to the donor community and try and get better consensus there as well. So I think good overall. Important to note that a number of the UN agencies were able to really fully implement flexibility measures. Certainly UNHCR, OCHA, WFP did a very good job of implementing these. UNICEF also came along to introduce funding flexibility measures. And some that aren't always engaged as closely, like IOM, UNFPA, UN Women also engaged in implementing these flexibility measures. So it was a good group, I would say, on the agency side, willing to commit to these specific measures.
Great. I'm going to come back to you, Jeremy, because I'd like to know a little bit more about the good humanitarian donorship and the way forward, as well as the UN agencies, what might come forward. But before we go to there, Alice, I'd really like to hear what's OCHA's approach to coordinating the responses to global emergency. It was really in a central position, particularly in terms of pulling together a global appeal and working to ensure resources got to the frontline actors. So how was trying to coordinate the humanitarian response, particularly in terms of marshaling the resources, different in this emergency compared to others?
No, thank you, Patty, and good to be with you here today. I'd say that in many ways our approach resembled the one we often take in these crisis situations, working to bring partners together, consolidating needs information, building the appeal document, and undertaking the usual advocacy, all under time pressure. But there were certainly some distinct challenges that we faced, and maybe I'll just touch on three. I do think the first thing I do want to say, though, is that I think we recognized in this response a really new level of collaboration between ISC organizations, between the UN and NGOs, and really a real effort by the humanitarian community to pull together what really was the first ever sort of global appeal on a global event. So, it was a massive undertaking, and I think we really were in uncharted waters, and have to recognize the great collaboration that was prompted, that led to new things like global monitoring frameworks, a real comprehensive picture of needs, things we haven't necessarily been able to achieve before. But we did have three key challenges along the way. The first is just the global nature of the pandemic, and having to reflect needs across countries that many of which we wouldn't have necessarily considered typically having humanitarian caseloads. So really expanding our reach and working with new country teams. Our usual, the appeal we had launched for our usual humanitarian programs early last year was for 55 countries, and we expanded that to 63. And I know there was a much longer list that was being discussed, and it was really difficult to figure out where to draw that line because the needs were so massive. I think the other thing that's reflected in the global nature of this crisis was that there were some global requirements, for example, for global common services, logistics, that actually had to be costed in a very complex global manner. So there were some just complexity of putting together this appeal given the global nature of it. I think the second thing to talk about is sort of the challenges of, you have ongoing humanitarian operations and humanitarian needs, and then you have this new crisis that unfolds. And so the challenges of finding coherence between new programs, ongoing programs, adjusting ongoing programs, and building the new programs into the overall response in a coherent way. So I'd say that was another key challenge of assembling an appeal that made sense and reflected the activities already going on, but also reflected new actions required. And maybe the third challenge I would just speak to is the one that's been mentioned earlier, which is around getting funding to our NGO partners. And we were very well aware of the challenges of fast-tracking resources to NGOs. Obviously, the UN agencies were mobilized in large part to do large procurements. So I think we saw, relative to other operations, a slight delay in terms of resources going to the NGO community. And I think we heard the voices of the NGO community being very concerned about that. From OCHA's pooled funds, we certainly did what we could, and I think we were very well positioned. We have these really flexible instruments, and we were able to take risks and innovate and try things we hadn't done before. Happy to talk through it with you, but I mean, overall, we gave about 500 million for the response in 2020, and then of that, about 200 and some million went to NGOs. So I think we landed in a good place. It required innovation, it required flexibility, it required speed, but happy to go in that in more detail. Thank you.
Yeah, so let's talk that through a little bit more in terms of the frontline actors. We're very much looking to the country-based pooled funds, as they do in many emergencies, for that rapid, flexible funding, speed and flexibility. Do you think the country-based pooled funds were able to perform in the face of the challenges presented by the onset of COVID-19? And yeah, I know you've said that you feel they were in the end, but what might have been some of the delays, and overall, what was your thoughts on how they did?
Thanks, Patty. I think the country-based pool funds performed very well. I think, in fact, they just brought back home their value and why they're so important in terms of serving frontline response. I think we saw three things. First of all, we saw speed, and that was really fantastic. We saw some funds allocate resources even before this was declared a public health emergency of international concern. So we saw some really quick action at the field level. We do feel that we landed in terms of the total amount provided by CBPFs in a very solid place. We estimate that 32% of the resources provided to the COVID response went to local NGOs, and then another 35% went to international NGOs. So I think we felt we landed in a good place. Some funds, obviously there's variations between the funds, but some funds gave up to 70% of their COVID response funding to NGOs. So some very strong numbers there. But very importantly, it was a chance also for us to innovate, knowing that our partners were under pressure given the massive change in context and operating environment. So we were able to introduce some flexibility measures along the lines of what Jeremy referred to, giving flexibility to our partners on how they use their budgets, allowing for reprogramming of budget lines, allowing cost extensions to grant agreements, adapting monitoring arrangements, anything that we could facilitate, to make the process a bit smoother. And I think these measures were really appreciated. I think the good news is that we're now looking at which ones we can keep on board. So, COVID may have left its legacy, a very positive legacy, at least one, and in this regard. And I think, but I think overall the crisis for us highlighted the need for modalities like the country-based pool funds that can provide resources to NGOs with speed, flexibility, and and with consistent amounts. And as you may have heard, we're now piloting a new type of fund, a regionally hosted fund, which was very much born out of this question of how can we set ourselves up to do more in more countries, should it be required in the future.
No, that's great. And obviously the flexibility and innovation in the financing mechanisms are a critical part of us to really advance. And hopefully we're going to hear some more about some of the learning that everyone hopes will be taken forward as a new way of working. Greg, you spoke when you started about the complexities of SAVE's programming and the challenges you faced. How was SAVE able to successfully adapt its programming over the past year? Were there any lessons learned as an organization, particularly in terms of how you fund your programs and what we'll advocate for from donor institutions?
Well, thanks. We did try to adapt and be as flexible as possible. And I do think, as we've been talking about, the flexibility of existing funding, ability to reprogram, repurpose is critically important, as is having additional flexible money. I mean, I think we are all aware that if you're programming with flexible funds raised through an appeal, that you can do much more than if you're simply funding through specific awards and restricted funding. I think we were pleased with the public and institutions' response to both appeals for new funds and for flexibility. I do think the point that just got made about the need to institutionalize some of these changes around flexible funding is really important. It's one of our big lessons, and UNHCR is a great example of an agency that did come reasonably quickly to offering flexibility in budgeting for new money. And they are, if I understand correctly, working hard now to institutionalize that, because it shouldn't take a global pandemic crisis to have flexibility in budget lines when you're trying to respond to humanitarian crisis. I mean, this was visible to the world to see, but changes in context and need for flexibility is there all the time. And so I think that's something that should be, just made part of regular practice. And I think we've seen for some donors be more flexible and trying to embed those changes. I think there's others who say, okay, go ahead and be flexible now, but we will return to business as usual as soon as possible. I think we need to call that out. I also think there was a bit of, well, you can repurpose this money, but then we're going to call that our COVID contribution. I think that there's a bit, we saw that early on. We said, oh, well, there's money reaching programs, but it was the same money. And so I do think we had to be really, all as much transparency as possible in those things. And I think, to the point Jerry made earlier, some of these things took a long time to get put in place, long time relative to a crisis. They were useful, but some of those changes we need to have happen on day one, and therefore we need to be ready to go on day one. As do we need to do a better job with local partners and being ready to fund those local partners in the moment. The other thing I think we saw, and just one more point, is just looking at the multi-sectoral nature of this. I think a lot of it focused on stop the spread early on, but very quickly, the protection issues, the child protection issues, education, the food security, the social protections, and those are ongoing issues today. And so, even as vaccines get rolled out and all of that, we do need to continue to look at the holistic nature of this crisis and the funding, the flexible funding required to respond to that crisis.
I couldn't agree more, Greg. I mean, it's so critical that people are looking at the recovery lens of this. It's going to take a long time. There's a whole year of school lost, for a lot of children who are already behind, just to tout the Save the Children world. But there's so many other factors that we all know have played out and that we knew were going to play out. But the initial focuses were very much on the stop the spread, and that's definitely there. Sustainability is another big issue. We're all talking about flexibility and funding. I think sustainability of these organizations is also a critical aspect for donors to really think through as they're moving ahead on financing. How do you maintain sustainability within that funding as well? Not just that the funding is coming, but that the organization has funds to maintain itself during this very difficult time. Jeremy, I mean, you talked about the flexibilities that were achieved, with the donor institutions, that there were some of them. Is there any possibility that these will be extended to become common practice? And of those that are offered, what do you think are the most important to preserve or expand going forward? I'm a little nervous about that because I'd hate for a donor to listen to this and be like, oh, here are the top three, but let's see if at least we can prioritize a few of them.
I know I hesitate to put that limitation on our objectives in this discussion, but I think we can highlight a few relevant points there. And on that first question, is there a possibility that these will be extended? I think a couple of things to note. One, this is not a new discussion. There's been ongoing discussion on pretty much all of these points that we've raised around funding flexibility, et cetera, from before COVID response. I think what we've seen is, in part because of this unprecedented nature, the type of response we've been facing, really a strong motivation to revisit some of these factors and really the necessary need to consider them in a more compressed period of time now. Even if we were slow in terms of humanitarian response this last year, we did speed up considerably some of these ongoing discussions that have been happening over a number of years to try and push for some agreement much more quickly. So they're not new factors. I think a couple of other things to note, even though we've made it out of 2020, a high degree of uncertainty remains in funding streams, in what programming will look like in the field, et cetera. So the question of somehow return to business as usual in the short term here, I think, is not something really that's should realistically be on the table. And there is that broader recognition, certainly within some of the IS discussions we've been having. The funding flexibility measures that were initially adopted were envisioned as something really limited to COVID response in 2020, with the idea that then we'd have a discussion to understand how those would continue or not, what would be relevant going forward. There's already been agreement to extend them as is through June of 2021, with the understanding that that'll give some agencies additional time to do some internal reflection on what worked, what didn't, reach out to partners, do some more proper analysis of that. And there's a range of practice. I think some agencies pretty much have been willing already to adopt them as is and move forward. Others taking a serious approach to want to do some internal reflection, as I stated. And there's a commitment to continue with this dialogue through June, at which point we'll be able to make more of a hard proposition for what should continue moving forward, not just under the umbrella of COVID response, but I think as we've been hinting at in the discussion already, what would make sense just to continue with the interest of enhancing our ability to respond effectively in humanitarian crises in general. So I think a good chance that those will continue. On the NGO side, when it comes to this question of what what should continue, or how do we prioritize? I mean, I should start by framing this. I think certainly among NGO colleagues, we see this largely as a package approach and not necessarily something where we'd want to pick and choose too much, within individual points. And I think the funding flexibility measures in general, just in terms of concept, are largely linked to our thinking about quality funding. That's been an ongoing piece of work, certainly through Grand Bargain and IASC as well. So how do we introduce more effective, quality, flexible funding? So we have funding flexibility measures with regard to contractual elements that we've largely talked about here, but other elements around quality funding, whether that's multi-year funding, lighter earmarking, reduced earmarking, et cetera. So I think a clear link to that discussion that's ongoing. And also localization as well. I think it was evident that a number of the flexibility measures introduced were of particular value to local and national partners who don't have the same large funding streams in place as some of our larger INGO colleagues to be able to be more flexible in their response. So a good link to those discussions. Ongoing now until June. I think key that we increasingly bring donors along too. I think this is a key element in how effective we are going to be in introducing, or I guess converting, these measures into business as usual, will be the degree to which we have consistency throughout the system. So not just something between UN agencies and their NGO colleagues, but how well are we getting donor governments to agree to consistent, similar measures as well, that then make it much easier to pass those benefits throughout the system. So I think key that we partner with GHD in that regard, alleviate some donor concerns around accountability. I know one of the concerns raised by donors is that there's a potential trade-off between quality funding, flexibility, and accountability. And that's a message that we've been trying to debate with donors more clearly to demonstrate that no, we can remain flexible, we can introduce quality funding measures and still remain accountable to the funds in a way that meets donor requirements and the requirements of their constituencies as well. So like that's a key message that we have to work with. Now, I guess when it comes down to the multi-million-dollar question around what do we prioritize, like I said, I think largely seen as a package approach. However, when you look at them, you can clearly see some much more specific to COVID in particular, and a few more what I would call broad measures that are going to be pretty relevant no matter what the situation. So I would highlight budget flexibility, in particular looking at budget flexibilities, not at the line item, but at the outcome levels and higher. It depends a little bit donor by donor, agency by agency, how those are identified, but we're talking about higher level budget flexibilities than at a very restrictive line item level. Certainly the direct/indirect cost discussion and flexibilities there is something that needs to continue. This is something that was not as explicit in the measures as some would have liked, but at least there's a reference there to the need to continue that discussion. And I think when it comes to how we handle overhead costs, for example, how we classify indirect costs, how those are consistent for all INGO and national NGO partners in the system, I think a need to revisit those in the flexibility discussion. And then simplification of systems. There were a few that fit into this area around improved use of electronic approvals, better harmonized reporting, simplified release of funds, that I think are all measures that are relevant to discuss beyond just a limited look at COVID. So there are some we can pick out, I think, as particularly important that we look at there, but I think important to look at the package and also within the broader lens of quality funding and localization, as I mentioned earlier.
No, and those are just such critical points, like people that if they were able to do it now, you could still do it later, right? Keep doing it. I mean, the philanthropy's given billions for COVID-19. And when they call us and they say, what should we do? I say, give now, give more, give later. Like just keep giving. We need to continue to put money into this situation. We need to continue looking at how to be as flexible as possible and really help with it. So, I mean, I think your messaging there, Jeremy, is just spot on. We really need these organizations to think about it actually wasn't the end of the world to change some of these procedures. So how about we look at continuing them in other ways, especially if it helps with that speed and flexibility and localization and all the things we've been promising ourselves for so long. Alice, it was a novel move. I mean, one of the things that the UN did to try and adapt was to get Central Emergency Response Funding, CERF, to be used in a select set of countries, providing funding directly to NGOs for COVID response. From your perspective, do you think did it work? Is it possibly precedent setting for future emergencies?
Thanks, Patty. No, I think it was, a great allocation and one of those risks that you take, which I think the ERC took, and rightfully so, to respond to, the challenges that the NGOs were facing around resourcing. As you know, we provided 25 million across 6 countries to 24 NGOs. 1/3 of them national NGOs, and really grateful to IOM who worked with us to channel those resources onwards to NGO partners. I think from a perspective, the allocation worked very well. I think we really, again, would like to applaud IOM for their creativity as well, because they had to work through their financial systems and their rules. But we did a quick survey, both of organizations that received the funds, which unsurprisingly were pleased, but also organizations that didn't receive the funds. And we said 76% of partners that hadn't received funds still thought that this allocation was going to bring strategic value that would not have been brought otherwise. So, the light survey modality showed that there was a lot of satisfaction. 87% of the NGOs we worked with were also satisfied, although they were new to CERF, and there were certainly a bit of a learning curve there. I think they appreciated the way the overall process was run and the timeliness of it. Now, I think as Jeremy just noted, we would be one of those organizations that are keen to learn before we fully adopt. And we have launched a consultancy to look into this allocation in greater detail and to give us some sort of impartial feedback on this modality. Obviously constraints remain with the Central Emergency Response Fund, which is a General Assembly mandated instrument. And it's very unlikely that we would manage to change the opinions of 200 member states in terms of how CERF can operate. Also because one of the advantages of providing through UN agencies is that we can fast track some of the due diligence procedures and have really, because it was seen as within the family, we can issue the money quicker. That being said, I think we would be open to seeing this as a tool amongst others, and something that we could draw on in cases where it's warranted. So, we're definitely keen to learn and to explore this further based on that learning. But I did want to also mention, Patty, that more broadly, and building on the work that the ISC has done on the results group, we are looking at CERF and the localization agenda more broadly. We know that 15% of CERF resources go to NGOs, but we want to look at what barriers might exist in our own administrative procedures and how we can continue to further that. So, building on the work on cascading funding by the UN agencies, how can we really build on that momentum and also move the dial a little bit more through the Central Emergency Response Fund?
Yeah, no, that's always been the challenge with CERF, but I feel that that's one of the, obviously this is a moment in time to really kind of challenge ourselves about how we can adapt and how we can adjust. And I'm just going to give everyone a chance. I'd really love to hear from everybody. What was your biggest take home lesson from the last year of COVID-19 response, the way the humanitarian system must change to be fit for purpose? What are some thoughts? What are your takeaways? Jeremy, why don't we start with you?
Sure. I guess speaking more generally, I've certainly realized that the job of being a school teacher is much more difficult than I ever anticipated. So we definitely have some personal reflection on COVID response, but I think that's part of the deal. Is it has been a very personal response for a lot of people in affecting pretty much every location that we're based in, which is unusual. I think some of the points that strike me the most based on our discussion so far, I think we've touched on it a few times. Certainly, the fact that quality, flexible funding is something that really helps the NGOs to remain um, flexible enough to respond, to shift quickly, given the large degrees of uncertainty in a pandemic situation like we've faced. I think it's key for our local partners to have uh, increased quality, flexible funding. And just with regard to the speed question, if that's done right from the start, it does give the system the ability to shift very quickly, and then a longer period of time to replenish those funds during the year as well. So I think that that degree of flexibility upfront in a response like this really something that's critical when we face future similar situations. Maybe just a quick addition. I mentioned it briefly, but in support of that, when it came to the speed question, we we really didn't have the right, I guess, flow of information data quickly enough to make some of those decisions. I think that is another big takeaway that's really almost a topic for a completely separate webinar, just around how we improve some of our data, our information gathered, and be able to truly track funding flows in terms of pass-through and timeliness in particular. I think we do have some uh, systems out there already, whether it's OCHA FTS, whether it's um, various forms of the IATI standard, that have the potential to do a lot, but we're not yet making maximum use of those systems. And B, the question of speed is really something we don't track well. So I think on the data side, there's a couple of points that would be helpful to examine further too.
Excellent. Thank you, Greg.
Sure, it's a really interesting question. And I think one of the things I take away is, when what you practice, what you prepare for is what you do. So if you're ready to be flexible, if you're ready to adapt, that's what you'll do. If you're sort of used to being inflexible, it's pretty hard to change. We were able to leverage, for example, a very strong online training platform that we have through the Humanitarian Leadership Academy, load up a bunch of COVID-19 materials on it, and help all of our country offices and their partners have rapid access to information. So being prepared is useful. If you have strong local partners, you'll work with them. If you don't, it's not the right time to start. And I think we have lots of places we did that well, and lots of places we could improve. But also, where you've learned to do something new, then let's apply it. So where we've learned that we can use SURF money for locally pooled funds, let's figure out how to do that. I'm not quite sure it's fully to the member state that that I would put that in. I do think it would be if you an agency say this is what we think is a good solution, that would move the needle. And also, we are very used to getting on planes. And so where you've learned that you don't have to necessarily get on a plane, well, maybe that's something that we've learned that we should be taking into account next time around as well.
No, that's an excellent point. Excellent point. Alicia?
Yeah, no, thanks, Patty. So I think, the point on preparedness has been made. I mean, when we look at this question operationally, I think our two key takeaways is, localization is key. And should this happen, again, and in these types of environments, we really need to invest in the capacity of local actors to play their role of first responders. And that's really, central. We talk about it, but I think this crisis brought it home all the more. And the other thing is maybe placing stronger emphasis on social protection mechanisms, given the secondary impact of this crisis, because they can be immediately scaled up, and especially the use of cash. So that's another point that operationally is really on our minds. From a financing perspective, I think for us, certainly the relevance and the utility of our pooled funds, that may seem like a very self-interested conclusion, but I think it does remind us that we need to do more, and we need to do more in more places. So I think we're really looking at how to expand our reach through the pooled funds. And last but not least, I think what we saw was that with more resources, we can actually do a whole lot more. Actually, exponentially, we had a very good level of funding at the beginning of 2020, and a lot of the innovations, and the ERC approved a few very innovative SURF allocations for issues around gender-based violence, for cash programming, and all of that was really allowed by this extra lot of money that we had. So, I think we have a strong story to tell that giving more money doesn't just result in more response, it actually results in innovation when the time requires it. So those are some of the key takeaways from our side. Thank you.
Yeah, and it's just so interesting. I mean, we're talking about this. This is a learning session on COVID aftershocks, but of course, we're still in the midst of COVID. I just want to thank everyone for joining us today at this session. It's been really a pleasure to speak with Alice, Jeremy, and Greg. Join me in thanking them for their great contributions, and have a great day.
Thank you, Patty.
Thank you, Patty.
Thank you.